Hi, I'm Rachel Deere. I'm a physical therapist at the Center for Integrative Health, and today I'd like to remind you about good posture and alignment. And we will start with the Pilates principles of a postural checklist. In order to have good posture, we look at our base of support first. So let's look at our feet. You're going to put your feet together in order to find where they need to be. Then spread your toes apart and lift your heels and put them behind your toes. That should put your feet at hip width. Okay, now we're going to go all the way up to the top of our head. And what I want you to think about here is lengthening your neck. So in order to do that, pretend there's a string pulling your head toward the ceiling. It's going to cause you to tuck your chin, almost as if you have a double chin, and that's going to lengthen the space between your skull and your shoulders. So lengthen your neck. Drop your shoulders away from your ears. Let your shoulder blades glide down your back. Pretend you have on really big earrings. You don't want them to touch your shoulders, so keep those shoulders away from your ears. Neck is long, shoulders down. Let's look at the rib cage. The rib cage needs to be softened so that it's not flared out. It needs to be sitting right above the pelvis. So if it's not softened, just kind of ease up that rib cage. Now let's look at your pelvis. Pelvis is going to be one of the most important areas we look at. Pretend your pelvis, I'm going to turn to the side for this. Pretend your pelvis is a bucket of water and it's full to the top. And you don't want to spill that water forward. See how if my pelvis tilts forward, the water spills out. You don't want to spill it too far backward either. You want to find that neutral spot where your pelvis will not spill any water. And that's where you want to keep it. And how we keep it there is by setting our center. In order to set our center, we engage our deep abdominal muscles. Our transverse abdominis is the muscle we're wanting to engage. And there's a couple ways to do that effectively. One way is to think about bringing these front hip bones toward one another just by tightening those deeper abdominal muscles. I tell people, think about buttoning a tight pair of pants where the button's almost reaching and you just want to get that button there. What do you do to achieve that? What do you do to make that button go in? And when you do that, you're tightening and activating that transverse abdominis. It's not a maximal contraction, it's just enough to get you buttoned. The other way to set your center that's effective is engaging your pelvic floor muscles. In order to do that, those are the muscles that control whether or not we urinate or stop the flow of urination. Those muscles are the ones we're trying to activate. So if you can activate those just at a low level, think of your pelvic floor as a 10-story building. You want to take those muscles to the 3rd floor of that building, just a minimal submaximal contraction there. That will also set your center and activate your transverse abdominis. So just a quick review. We've got our feet in the hip width position. We start here, flare out the toes, heels go behind, then jump right up to your neck, elongate the neck, drop the shoulders, soften the rib cage, make that bucket neutral, your pelvis, and then set your center, whether it's buttoning that pair of jeans that's a little too tight or engaging the pelvic floor muscles. And that's your postural checklist. This is what I want you to be thinking about all day long. No matter what the activity is, try and get yourself reset in this position in order to have good alignment, reduce pain, and keep your postural muscles active throughout the day.